Thank you for joining me this afternoon to consider my proposal on life review therapy for seniors in Maine. My name is Angela Cousins, and I am a counselor in training with Concordia University Irvine and the Townsend Institute. I would like to welcome members of the Bangor Counseling Center, Penquist Senior Services, Winterberry Heights, Ross Manor, the Eastern Area Agency on Aging, Discover Church, and the Rock Church. I know that you are all invested in our community and Maine seniors, and by coming together, we can make a difference and a significant impact on the lives of older adults in our community. I also have a handout for each one of you that can follow along with some of the major points of my presentation so that you can have it to take along with you. The mission of this community project is to provide a resource to older adults that improves their mental health, increases their quality of life, and introduces them to mental health services and counselors in a way that overcomes barriers and misconceptions currently existing to utilizing these services. Now, you are all actively engaged with seniors in our community, so you may know some of this information, but I think it's also just helpful to review and to give us some perspective. So in Maine, those 65 and older make up 22% of our population, making Maine the state with the highest percentage of elderly residents, and also the highest median age of 44.8 in the entire country. The elderly population across the world is also growing quickly. In 2020, there were 1 billion people over the age of 60. By 2030, that number is expected to grow to 1.4 billion, representing 1 in 6 people. Between 2020 and 2050, the number of adults over 80 is expected to triple, which is just incredible. Older adults have always been valuable members of our communities, but now they are also, on average, living longer and spending more years as active societal contributors. This is fantastic for all of us that we have so much to gain from these older members of our communities. As the elderly population of Maine and the average life expectancy increases, the quality of life for those over 65 has become a critical concern and a significant need that this project aims to address. As our seniors invest their years in our communities, we also need to be active in investing in them. So, as you'll see here, there's a significant need for increased access to mental health services for the elderly population of Maine, which has a higher rate of depressive disorders, 17.3%, than the national average at 15.5% for this age group. This can be seen on the graph here and also on the graph on your handout, that the national average of depressive disorders is shown here in the blue squares, and the average of depressive disorders in those 65 and older in Maine are shown in the blue circles. Now, it may not seem like a significant difference, but if you look, even that tiny bit of gap represents a large amount of people. And our Maine seniors struggle with depression more than those in 39 other states in our country. This is a need that we need to address. Currently, the most common mental health concern among seniors is anxiety. And up to 2/3 of these seniors struggling with anxiety do not get the treatment they need. The need for increased access to mental health care among older adults in Maine is clear. In 2021, 37.5% of adults total of all ages in Maine reported symptoms of anxiety or depression. That is over 1/3 of our population. 12.8% of those were unable to get counseling or therapy. Over 260,000 people in Maine, that's about 1/5 of our population, live in a community that does not have an adequate amount of mental health professionals. Furthermore, in 2021, the percentage of adults receiving counseling from a mental health professional showed consistent decreases with age, with 23.2% of those aged 18 to 44 receiving counseling, followed by 21.2% of adults aged 45 to 64, but only 18.9% of those aged 65 and older were receiving the counseling they needed. The availability of care is concerning. First, there's a significant shortage of mental health providers in Maine, which I'm sure many of you are aware of. A Maine Behavioral Health Access Point and study conducted just this year in January and February found that 8,913 clients were waiting for mental health counseling for an average of 32 weeks. That is a significant amount of time to wait for help when you're struggling and suffering. This report also showed that 35 vacancies were reported for every 100 mental health clinicians in Maine. I'm sure all of you are feeling that as well as I am. In addition to a lack of providers and high costs, the elderly face additional societal and ecological barriers that contribute to their significant needs. The elderly comprise a frequently overlooked and underserved population. Older adults may simply not be receiving the mental health diagnosis that they need because their symptoms are explained away as a normal part of aging. Depression and anxiety do not have to be a normal part of aging. Not only is there a need for increased access to mental health services, but Maine needs mental health programs that address and overcome the barriers seniors face in seeking treatment or counseling. Barriers to Mainers seeking treatment include a negative stigma related to mental illness, especially amongst the older generations in Maine. There are challenges experienced with rural isolation, an attitude of independence that resists seeking help, combined with a belief that they can often overcome struggles on their own, a belief that seeking help is a personal failure, and that self-reliance is a virtue. Fear of judgment and a tendency to accept depression as a normal part of aging also contribute to the need. Now, I've lived in Maine for over 20 years, but I grew up in the Midwest, and I can attest to the reality that Mainers have the highest levels of independence and self-reliance I have ever encountered. Mainers are some of the hardest working people, but they're also fiercely against asking for help. This attitude, especially dominant I've found in older generations, is actually hurting our communities and the ability for people to receive the help they really need to live their lives fully. So the goals of this project include providing mental health services to elderly community members who have not had access to or have not engaged previously or recently with professional counseling or therapy. Specifically, we want to introduce mental health services and counseling practices and the benefits of seeking help to participants through a method, which we're going to talk about in a little bit, which is life review therapy, with less stigma attached, because life review and reminiscing are normal parts of aging. In addition, we want to introduce participants to counselors and mental health professionals through a less formal or clinical setting in order to build trust and break down misconceptions, which hopefully results in every participant having a trusted mental health professional they can continue to engage in therapy with if necessary at the conclusion of the group. We hope to put clients at ease with a therapy practice that feels natural because they don't need to be taught specific new skills as they are already experts at the content of their own lives. We also want to use this project to help older Mainers, especially those living in rural areas, overcome isolation by providing a group for them to engage with. And finally, two of the measurable goals of this project are to reduce depressive symptoms among older adults and to increase all participants' perceived quality of life, which will be demonstrated through the pre-test and post-test surveys. Those are our goals. Now, how are we actually going to do it? Well, the intervention for this community project will be providing life review therapy groups for Maine community members aged 65 and older. Now, life review therapy is a process guided by a clinical mental health counselor, a psychologist, a social worker that is trained in life review therapy. Life review therapy is a process that encourages individuals within the group to recall past experiences, as you'll see here, good and bad memories, and examine them for themes throughout their life stages that they may not have recognized on their own. In life review therapy, an individual may recall forgotten experiences, things that they didn't even realize were potentially weighing them down or having an impact on their life. They will also discuss positive memories and experiences in their lives. Reviewing their lives in this way can also bring unresolved conflicts from the past into the present for resolution. It can also help participants feel useful and valued again as they are able to look back and celebrate their life and help older adults struggling with despair or depression move forward with a sense of acceptance. These are some wonderful benefits of this particular type of therapy. Now, the details of what these groups will actually look like in practice. So the life review therapy groups will be 2-hour group sessions led by professional counselors, and they'll meet once a week for 8 straight weeks. Sessions may include group discussions, written assignments, and creative mediums such as photographs, music, and life mapping. All of these added elements can trigger important memories and elements of the life review. Now, a family member is encouraged to participate. It's not required, but it definitely adds a lot to the group to have them fully engage with their loved ones. Pending interest and availability, sessions would be led for and at local participating nursing homes or assisted living facilities such as Ross Manor, Winterberry Heights, and Dirigo Pines. Some of you are here today. Additionally, spiritual life review groups, which specifically discuss faith and spirituality as part of the life review process, could be led by counselors at local churches such as Discover Church and the Rock Church, among others. These groups would be open to members of these churches and also community members at large. We want to provide a couple of different places where people can engage where they might feel the most comfortable. Now, the Substance Abuse and Mental Health Services Administration shows evidence-based support for life review therapy alleviating depression symptoms in the elderly. Life review therapy has also been shown to improve the quality of life, positive feelings, and spiritual well-being of those participating. We want to make sure that these are the outcomes and that these are the things that are actually happening in our groups. So evaluation will happen through pre-test and post-test surveys taken before and after the life review therapy groups. Surveys will include questions involving levels of trust and comfort with the counseling and the counselors, a willingness to seek help and formal counseling, levels of frequency of depressive symptoms, and quality of life questions that are based on the World Health Organization Quality of Life Questionnaire. We'll also ask family members of caregivers or caregivers of clients involved in the life review process to complete a post-test and a pre-test evaluation of their perceived program effectiveness so we can get their feedback as well. We will know that this intervention was successful if Mainers over 65 in need of mental health care actively participate, if the program meets the included goals demonstrated and shared earlier, and through the participants' willingness to engage in the process actively. I think that there is the potential for some really significant outcomes here, but we need your help. We believe that these groups can make a significant impact in the life of Maine seniors, but it means that we need all of you to participate. The specialty mental health sector, such as the Bangor Counseling Center and Community Health and Counseling Services, will be crucial in helping us employ mental health counselors, psychologists, social workers, or marriage and family therapists trained in implementing life review therapy. We know that there's a shortage of counselors, but if we can get these counselors to work in a group setting and to be treating multiple clients at a time, it could go a long way in the amount of people that we can reach. These specialists will lead the therapy groups and be available to group members for possible ongoing therapy after the group. The general primary care network sector, such as the Penquist Senior Services and Ross Manor and Winterberry Heights, will be utilized by incorporating nursing homes and long-term care centers as a referral system for patients who might benefit from this type of therapy and by providing us a location for groups to meet. The human and volunteer services sectors, such as the Eastern Area Agency on Aging, Discover Church, and the Rock Church, will be utilized to recruit clients and group members to help fund and implement the program. In conclusion, we know that older adults are unlikely on their own to seek the help of mental health services and counselors, especially here in Maine. As communities that seek to value every member, we cannot let our oldest members fall through the cracks. It is our responsibility to find ways to meet the mental health needs of the older generation in a way that begins to destigmatize mental health treatment. Life review therapy has proven to be an effective tool in reducing depression and increasing the quality of life in the elderly. I believe this could effectively increase access to mental health services and decrease barriers to receiving those services for older adults throughout Maine. Together, we can make a difference. Thank you so much for engaging with me in this process of serving our seniors in Maine. We know that you know it's as important as we do. So please feel free to reach out to me with any questions that you might have. And I will be in contact with each of you in the coming weeks to answer any remaining questions and to determine your level of interest and involvement with this project. Thank you again, and have a wonderful afternoon.